I was a hospital CEO for 10 years before I took this role 6 years ago. Just about the time I became CEO of the hospital coincided with when the Institute of Medicine released the 2 Areas Human report, which cited that approximately 98,000 people a year die from medical errors in hospitals.
Good morning, Mr. Hoffman.
It sort of sobered me as I thought more about it, because one death is too many. One death is tragic.
Lay your arm down like this and just relax it.
It really started me thinking about what we fundamentally owed the patient.
Just breathe regularly. One more time.
When we designed our program here in Indiana for the Hospital Engagement Network, we really focused on a couple of different high-level topics. We wanted to continue to build trust in the local communities through our regional patient safety coalitions. We also worked very hard on building workforce development
One of the initiatives.
and capacity within every hospital to have tools and methods for improvement.
All of the objectives, so
I think the Hospital Engagement Network, when it came to Indiana, it was the missing piece. It was the link that pulled everything together, where I felt like at our hospital we were running in 12 different directions, and this gave us focus.
No, just for one, and then the other one.
As part of the Hospital Engagement Network funding, IHA was able to really bring on board key staff members. We have 2 patient safety quality advisors who have broad-based experience in healthcare. They do site visits, they staff the regional patient safety coalitions, and they also bring ideas from one coalition and one hospital to the next.
We can improve outcomes.
One of the early ways that we feel that we made an impact in Indiana was to emphasize the importance of reducing early elective deliveries.
for induction of less than 39 weeks.
Our Indiana Hospital Association Board of Directors passed a resolution that supported all Indiana hospitals to adopt a hard stop policy. In 2011, the participating hospitals' early elective delivery rate was around 11%, and by March of 2013, it had reduced to around 3%. Another really great example is in bloodstream infections. We knew that patients were dying for all-cause sepsis mortality at a rate of around 16% back in 2009. Through organized efforts through the regional patient safety coalitions, that rate has dropped to just over 9%.
Explaining why we're doing this.
Our staff has really rallied around how to make this better. I think what's really fascinating is that our physicians now look forward to seeing the results of this work.
We participate in the West Central Patient Safety Coalition.
I bring information from the regional coalition that I'm part of. I bring information from the national coalition that I've been able to attend, and I'm able to show what's going on around the state of Indiana. And it helps them feel pride in using best practices.
This is very impressive data.
The goal of being the safest state in the country is really critical.
Thanks for all your help.
I think good is the enemy of great. So we can stay stuck in being good and we'll never get to great. So I think that kind of aspirational goal is critical to really making the kind of change that we have to make for the patients that rely on us.
Thanks for tuning in to HN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.